Paschal.
Thanks, Tyler. Wow. Got this noise just coming right into the back of your head. That's pretty incredible. Yeah, John, you're right. This is weird talking on a corner. The street, it's like you're on a street corner trying to hawk something. So I'm going to talk about the M-Series wires, but what I really want to focus on is basically practice efficiency, practice time. How much treatment time are we doing for our patients? I am laser focused on my practice in trying to get things down to that 12-month mark in braces and doing everything we possibly can to get them out of those braces. One of the components, one of the tools is 3 wires. And the reason why is because patients are seeking out treatment to get what they get themselves satisfied. Oh, not working. There we go. Why is that? Because the smile is the most noticed feature when we meet somebody new. 77% of women that think people with crooked teeth are more impactful than receding hairline. I mean, that's an amazing statistic to me. 78% with crooked teeth are deemed to be more unsuccessful. Another survey, I am having a hard time with this clicker. Okay, see if we can get it going. 58% more likely to be successful. 57% would rather have a nice smile than clear skin. 87% would forego something for a year in order to have a nice smile. But the impediment is treatment time. And this even extends to, unfortunately, this is, okay, we'll see. So even adolescents, they're more emphasized on smiles now. The best thing is more confidence. I don't have to be ashamed of my teeth anymore. It makes me feel better about myself. That was just published in the European Journal back in January. All that, 25% of all adults are unsatisfied with their smiles. Another 20% had treatment and they're still unsatisfied. So that's about 45% of the population on that survey. Align even took a survey and they think that it's as high as 74% of all people are unsatisfied with their smiles. So in the North America or in the US, if you look at 330 million people total, you take out 30 million people just because they're either too old or too young, that's our total demographic we could service. That's 74% that Align surveyed. That's 244 million people left in our market. How many people do we treat? Or sorry about that. How many people do we treat? 3 million people a year. That's it. If we could sit there and double that number or even just go up by another million, imagine what that means to our practice. Now, companies like all the direct-to-consumer aligners, what are they going for? They're going for that 150 to 244 million people. That's what they want to capture. They could really care less about the 3 million. But treatment time is standing in the way. It's the perceptions that people have about the treatment that we can deliver. There it is in half. I'm sorry. This clicker is sort of haphazard. What do we have to do? We've got to deliver value to our patients. And the value that we need to deliver is decreased treatment times. And we need to make the complex more predictable. And that's one of the things that we've done with Henry Schein and Motion First. That whole philosophy has made all the complexities in my practice a lot more simple to deliver. Okay, I'm just going to go to advancing manually. The next question that everybody always asks, if we're going to get into 12 months treatment time, can they pay? The answer to that question is yes. We have divested our treatment time in our practice. The treatment time is in blue on the bottom, that's 100% of treatment time, and then in pink as you go along, that's default rate on patients after we're done with treatment. So what this graph shows is a total number of defaults over OrthoFi practices, which are hundreds and thousands of patients. The most likely they're going to default on you is in the first 20 to 30% of treatment. So if you set up your protocols, you'll capture that earlier. The other interesting thing is $2,400 is your average collection on the default, so you're almost getting to your overheads. 95% of defaults happen during treatment time. So you don't have to worry about pairing treatment time and payment time. So making the complex more predictable. This right here is my workflow for 100% of our patients now. We do Motion First if they're class 2 or class 3 or even have mesially rotated molars or pseudo class 2s. Then we move them into brackets. Then we detail and retain. This is our workflow that we have in our practice. It's simplified and it's also paralleled to anything with our aligner patients. The beauty of that is our aligner patients, they don't even have to make a choice in the beginning of treatment. If we start them in motion, we can go either way with aligner or brackets during treatment. The other nice thing is I can move in and out of brackets and aligners right now in our practice because of the protocols we have in place at will. We're doing in-house printing, we're doing SLX clear aligners, and that is a very doable thing under these protocols. Right now, the focus in my practice is to finish about 85% of our patients in clear aligners, no matter how they started, within the next year to 2 years. And we're making those conversions. I think we print in-house now, probably 70 aligners a week, and SLX Clear has been a huge benefit to that protocol. So when I converted over to the SLX bracket, I came over from the Q bracket. This was my protocol: 014, 018, 1425, 1825, repos, 1925 TMA, multiple detail appointments, and then debond. So took over a year. If I was doing 12-week recalls in the beginning, that level of that just wasn't satisfactory to getting it under 12 months. One of the first things we noticed about this bracket when we started implementing it in our office was two big factors. One was the width of the door, and then the other was the inner bracket distance, the two specific widths of the brackets. Those two things enable the wires to engage in your rotational control to a far more effective level than we had before. So what it did is it started me rethinking my protocol as far as the wires were concerned. So now what we did is we reassessed it, and we started going 014. And I also converted to bonding 5 and 5 first and leaving the 6s off. Then second appointment, we bond 6s and 7s because they're the most likely brackets to break early in treatment. Put in the 018 arch wire. Then we go to a 2020. And you notice this is within 10 weeks, we're already in a 2020 on our average patient. So we're already getting that torque control, derotation control to a far better level than we were with just an 018 arch wire. Have our reposition appointment. Then we go to a 1925 night tie. 1925 TMA, so we're getting into our finishing wires at 25 weeks. And we're already getting into our finish wires. Imagine how much time you have to finish your cases and detail your cases, because that's the defining thing that we have to, that defines us as orthodontists and what we can do. Couple of detail appointments, can't get rid of those. Then our pre-debond and our debond appointments. So you add all that up, and you're within 40 weeks under this protocol. So let's take a look at a couple of cases under this protocol. This young lady comes in, pretty much a full step class 2. Good arch form, no cross bites, no severe transverse issues, but class 2. We bond in our motion, and this is after 2 months. Look at the correction that we've gotten in 2 months. Now, see the gingival response? Don't worry about that, because you'll see that resolves. Sometimes we get that, but that doesn't always happen. Not permanent. Here she is after 9.5 months, 13 months total. We're already in our finishing wires, bonded our 7s. We had to delay a little bit for that. So 12.5 months. And this is in the old archwire protocol, all finished up. Full correction, nice control of our arch form, nice occlusion, in control the whole time. And I just love the freedom that having motion first enables in the freedom to our practice. I look out on our practice now, and the complications and the problems that we used to have with class 2 correction have just been eliminated. So take a look at this young man. Comes in at almost 13 years of age, severe crowding, class 2 molar, ectopically erupting canines, pretty formidable case. Now, I agree with what everybody's thinking. Remove upper 4s, call it a day. The only problem is, mom turns around and says, we're not taking teeth out. So fall back, all right? What can we do? So we apply motion. Here's what a CBCT looks like. In this case, it's also available on Orthoscience if you want to take a look at it. All these records are on Orthoscience. So look at this correction. After 1 month, that's where he's at. So Malik keeps on going. 2.5 months, we're almost corrected on the right side, getting pretty good on the, or almost corrected on the left, getting pretty good on the right. Unbelievable response. Overcorrected on the left side, fully corrected on the right. 3.5 months. Just amazing. So we bond up. This is him in his 018 arch wire. So 1 month motion, 5 months motion, 1 month SLX. Six months total. So now we bond up his 6s and 7s, and we keep on going with our protocol. 018 over 2020. I had to worry about a crossbite on the upper right 6 on this case, so that's why I stayed in the 018 a little bit longer. So only 4 months SLX, and we're leveling and aligning. Here he is at his repose. You'll notice the only thing we lost on this case by not extracting teeth is I did lose a little bit lower 1. We lost about 6 degrees on that one. So 5 months SLX, 10 months total. Arch forms established, crossbite solved. We're already in our 2020 arch wires after only being in SLX for 6 months. Seven months, really getting that occlusion to lock in, put in our TMAs. 14 months. Nice arch form. Already trying to get into our finish, starting to think about it. Unfortunately, Malik delayed a little bit coming into some appointments, so 17 months. Lower arch wires left out. We got our retainer bonded, our bonded retainer on the lower. Then we get him back a month later, and here he is all finished up. Compare the before and afters in a second. Like I said, lost a little bit on the lower ones. But Malik is incredibly happy. He came up to me at a tennis match the other day in our small town, and he's like, how are you doing, Dr. Paschal? And I was like, how are you doing, Malik? And he said, I am rocking my smile. And it was kind of cool. I mean, he knew what we were able to do for him, and he fully appreciated it. Okay. So very proud of that result. Proud for him. There is his before and afters on his CBCT. And so Malik, I would say, is definitely rocking that new smile now, all because of motion. So what are all these things doing for our practice when we convert it over from our Q bracket? We're having far less bracket debonds, far less rebonds per case. The reason for that is basically the bracket's going on in the right spot. We're able to visualize it, use our visual cues. The pad design is far better for a majority of teeth. So we're just seeing less reasons to rebond cases. Wire bends at the end of treatment, far less. Time in braces, far less than what we were doing before. We're actually starting to achieve our goal of getting down under 12 months. We went back and we looked, 3 practices, 60 cases, 10 finishes of SLX, 10 finishes of Q. And in every category we measured, we had an improvement. Every single category, from total appointments, chair times, repos, total months in treatment. And that turned into huge time savings. Detailing appointments were down, repo appointments were down, total chair time was down. And that just improves profitability if that's the way you want to do it, or it gives you more chairs to open up for more appointments. All this was just due to a bracket change and wire protocol changes. So this is the old protocol that we were using for that study, and we got to talking, and we were noticing that we were jumping in a lot of cases from the 014 or the 018 right into the 2020, and then we were missing the copper nitai, the 1925. And so we started talking about, well, what if we were able to eliminate the 018 and able to eliminate the 1925 nitai from this protocol, and maybe not eliminate it, but de-emphasize using it, get it out of the normal routine archwire sequence. Still have it in our toolbox, but that's not the norm. Well, one of the things we had to do is we had to think about, okay, the 014 is not going to jump real well to the 2020 all the time, so it just doesn't de-rotate everything. But the 015 would do a pretty good job. Didn't do the 016 because you just can't start out in an 016 on the majority of our cases. So the 015 seemed to hit that sweet spot. So we designed an 015 archwire, and now we're doing a general protocol of 015, 2020, and 1925. The other thing I want you to notice about the edgewise wires is the corners are rounded. Those corners are mate with the inside bevel on the inside of these brackets. Why is that? It's to decrease that angular friction that occurs when you're looking at torque, space closure, that kind of chattering that can occur on the inside of the bracket. Any opportunity to improve efficiency, and that's what the engineers have designed into this wire and bracket system. Here's another example, another view of that same thing. So this is our general protocol right now. M1, M2, M3 beta. So you've got an 015 copper nitai, a 2020 copper nitai, and a 1925 nickel or TMA, excuse me, or beta titanium. So we also changed the name of them, M1, 2, and 3, because one of the things we noticed in our practices is that with our Force 1 and Force 2 elastics, we stopped talking about what size and weight the elastics were in our practice. We just call out Force 1, Force 2. It makes everything easier in our practice. So we said, well, why don't we just do the same thing with the arch wires? Just go M1, M2, M3 and just call out. They're ready for M2. Now, not everybody's going to fit into this protocol, and we realize that, so we've got to have options. So we have the M15, M25, and M3 steel for those times when you need to do a little bit more between stages and fit something else in. But the intention is do a little bit more between this stage and then get back up into the top and then go back into your standard sequence. It's not meant to go through every single one, every single patient. So you maintain your efficiencies and you get your staff aware of any time that we can improve efficiency, we're going to take advantage of it. So here's our new sequence that we're using. We're bonding upper lower 5 to 5s again, no change there, but we're putting in the 015 arch wire. 2020, bonding upper lower 6s and 7s at that stage, and the 2020 arch wire does this very efficiently. I would frequently do this on the other protocol as well. Repositions. 1925 TMA. Or CNA. 2 detail appointments, that's typically what I see. And then our pre-debond appointment and debond. 30 weeks is what that protocol would be. Not everybody's going to be 30 weeks, but this is the standard that we want to put everything to. So if we can get everything at 8 to 10 months, where that's our average, and get them out of brackets, then we're doing really good. Other additional controls, inventory control. When you don't have to order as many brackets or as many wires all the time, your inventory is in a far better control. Office communication, improvement there. We talked about the M1, 2, and 3. And then you have a definitive protocol that you can point to for training purposes, for keeping all your cases on track. So here's a couple of cases on this new protocol. This young man comes in. Class 1 crowded, blocked out lower left 2. So we put in our 015s, open coil spring over the lower left 2. Let that percolate. After 3.5 months, here's where he's at. Now on this one, I dropped into an 018 because I wanted to establish a little bit more, and the reason is, it's just simply because of this transition here. That was a clinical decision. So we dropped down into that M1.5 wire. Allow it to percolate a little bit. Then we go into our 2020, and this is the day the 2020 was inserted. Put him on some Class 2 elastics. And this is where he's at 4.5 months. And we're already leveled in a line, lower left two's in place, and we're already getting, I'm already starting to think about finishing. This young lady comes in. She's Class 2, right crossbite, or the right Class 2 and a right crossbite. Unilateral Class 2s in my practice used to be a Forcis. And that was what or either a Forcis or a Herbst appliance. And we were immediately committed to a 2 to 2.5 year treatment plan, sometimes even 3. So we bond her up with our motion appliance. She's 5 months in the motion, and this is where she's at. Fully corrected. I'd like to overcorrect a little bit more on the right side, but she had some moments where she was not wearing her aligner on the lower. Bond to 5.5, put our 015 arch wire in. She had a tongue habit, so we put in some tongue tamers. I would recommend not doing what I did here, bond tongue tamers upper and lower, because they will reposition their tongue into the arch where the tamers aren't. She actually learned pretty well, so we also give her tongue exercises. If you've never seen Louise speak on tongue exercises, you've got to. That changed my practice. So 4 months XLX, 10 months total. Here we are all bonded up. And look at the resolution that we've got. Only 4 months in brackets. Fixing the crossbite, we're doing crossbite elastics. Arch farm is pretty well established. 5 months SLX, getting into our TMAs already. So we're already in finishing wires very early in treatment. 6 months. Gate door open. And here she is at 7 months, and this was just a couple weeks ago, and we're getting ready to take her brackets off. So we bond a retainer and remove brackets. So that's where she currently is. So very efficient protocol, and it has revolutionized what we're doing in our practice, just having the consideration of going from that 015, 2020, 1925. So this is our current sequence. This is what we're moving forward with in our practice, and our focus is to get down to that 8 to 10, 8 to 11 month protocol where we're getting them out of braces as soon as possible. That paired with sagittal first is what's accelerating our treatment and our practice efficiencies. And we're able to get patients into either clear aligners quicker or get them out of braces. So thank you for your time today. I know you got a lot of stuff to go see. Appreciate everybody's attention. Have a great day.